You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with small diameter or mini dental implants. With us, we have an expert on the topic, Dr. Peyman Beigi. Dr. Beigi, welcome to the program.
Thank you for having me. It's a pleasure.
Now, so mini implants, this is kind of your focus on your practice?
90% of my practice, yes.
Is that right? Now, for people that don't know your practice, like who's the typical patient that's coming in for tooth replacement with mini implants?
The ones with existing dentures, and the ones who are heading to be a denture patient. They have teeth that are non-restorable, and we have to extract them and give them dentures, and we can help them with mini implants.
There's two types of implants,
Yes.
regular implants and small diameter mini implants. You like the mini implants. In fact, your own mother.
Yes, I did it for my mother. We placed 6 implants and we did the snap-on, and because she didn't want dentures. She just didn't want the feeling of the plastic on her palate, which I can understand because you won't be able to taste the food the same, So we did it for her and she's been very happy. It's been 12 years now. I've been doing them for 13 years, and she's had them for 12 years now,
Okay, good.
Yeah.
Now, we've talked in my green room and on the telephone. You say nobody should be wearing a regular denture.
Patients with dentures, they're like you and me. They want to taste the food, they want to enjoy life. They want to be able to speak, phonetics, and cosmetically, they don't want to be talking and the denture coming out, so they want teeth again, and we give them their teeth back, so they be able to. Some patients tell you, I hate taking this thing out and put it in, I don't want to do that, and we can help them with that.
With the
mini implants, yeah.
Now, are there a lot of denture wearers where you are?
There are so many. I see them on daily basis.
Really?
Yeah. On daily basis, I see so many patients, and it's just the way it is because of dry mouth. Patients are taking medications, they get dry mouth, and they start losing teeth, for many reasons, they have systemic conditions, and so we end up.
So Massachusetts, and it's a big place. I mean, how many thousands of people are wearing like an upper lower denture, in your opinion, like an estimate?
I can't give you a number, but a lot of.
Like thousands?
More than that, I would say.
Okay.
More than that, yeah.
If these mini implants are so good, why aren't they all doing it? Why aren't they all coming in to get
You
a
mean
denture
patients?
locked in?
Yeah.
Yes.
They don't know because you're a denture patient. You got your teeth pulled 10 years ago and they give you your denture. You never went back to see your dentist. A lot of them don't go back to see a dentist unless, there's pain or the denture is really loose, So shows like this will help them understand that there's hope, And once they find out, then they come in and they say, listen, I'm tired of this, please help me. So back to your question, why they're not all coming in, it's because sometimes they think they're too old. Or sometimes they
how old can you be to get these
90
mini implants?
years old, 100 years old. I mean,
really?
One of our colleagues, actually the one who trained me, Dr. Todd Shatkan, did it on someone who was almost 100 years old, 99 years old.
Why would a 90-year-old or 100-year-old want to do that?
They want to be able to eat, they want to be able to eat and they want to be able to taste food, So
it doesn't matter how old you are?
Doesn't matter how old you are.
Yeah, but isn't it true if you've been wearing a denture like 20 years, you don't have enough bone to do this?
No, that's not true. That's not true at all. There are patients who have no bone, but that's not because they've been wearing dentures too long. No. One of my first cases, again, 12, 13 years ago, was a lady that had dentures since age 20. Okay. And when she saw me, she was in her 60s for 40-something years. So with her, what we did was I gave her mini implants and teeth, that snap in, and the upper and lower. She came back and she said that everyone thought that she had done some facelift.
Okay.
She looked so much younger, and she was so thrilled and she was so happy.
How soon after they get these mini implants, how soon can they eat after the surgery?
Right away,
Really?
But of course, there are extreme cases that we tell them that, like extreme cases that, sometimes we see like maybe 1% or 2%. We tell them like soft diet, but for most of the time we tell them they can eat, soft food. I always recommend starting with soft food, and then gradually change into regular diet. Yeah.
Now I have to tell you this because I've had doctors, dentists on this show, and they say, Randy, the problem with these mini small diameter implants is that they fall out or they're not big enough. They're not as good as the regular implants. What is your response to that?
That's not true because studies have shown, they've done studies, Todd Shatkin has done many studies actually, that he has followed 6,000 patients in the last 20 years with MiniDental implants, and they've been very successful. In some cases, they've been more successful than conventional implants.
Okay, so you've been doing this for.
I've been doing them for the past 13 years, since 2005.
People that are still in their implants?
My mom being one of them, yeah.
Okay.
Yeah.
So no more dentures?
No more dentures,
the way we know them today.
No more dentures. Unless they choose to have dentures, but no more dentures, yeah.
Now, I know a couple of denture wearers, and they don't ever complain. Are you saying there's no such thing as a happy denture wearer?
They don't know what they're missing. They don't know that once we help them with mini implants and and give them teeth, they don't have to feel that palate anymore. They don't have to feel the plastic anymore, So if they don't know it, they're fine. They're in their comfort zone and they're okay. But once they find out about it, then they come in and they said, that's what I want to do. I get a lot of patients who hear from other patients who've had it done by me or by other dentists, and they come and say, I really want to have mini implants. I'm here in your practice because I heard you do mini implants.
Really? So they're asking for it now?
They're asking for it. I've been told by my dentist that I can't have conventional implants, but I don't want surgical procedures. I'm 70-something years old. I'm on a blood thinner, and I don't want to do that. I want to, and I've done it for patients who are on blood, taking blood thinners, and they've been fine,
But what about like gum disease? If you have bad gums, right? That's why you're losing your teeth. Can they still do these mini implants?
Definitely, because once you take the tooth out that cannot be saved, or the teeth that cannot be saved, there's no more bacteria, and the gums start healing, and now it's a perfect environment for placing implants. I'll tell you a story of a patient who came in. I had done some mini dental implants for his fiance a year before that, and he came in and he said, you got to do something about my teeth. And the teeth they couldn't be saved, bad gums, decayed teeth, And I remember when we extracted the teeth and we placed mini implants and we gave him some beautiful teeth, his fiance, who was in the waiting room, came into the operatory. She started crying. She couldn't believe it. I mean, he looked completely like a different person. And it was very emotional for me to see that mini dental implants can do this for patients and can make them feel that way. I had another patient, same thing, bad gums, a lot of infection, and she came in. She said, I don't think you can help me. And I told her, I didn't want to be rude, but I said, well, that's not right. I didn't want to say you're wrong. I just said, that's not right. We can help you because we have helped other patients. With this woman, she didn't want dentures. She said, listen, my teeth are bad. I know that, but I don't want dentures, and can you help me? I said, yeah, we can help you. We can give you teeth, we don't need to give you dentures. We can give you teeth, She said, how? But I have bad gums, I have infection. Once you see my teeth, you know that I'm not a candidate. And I said, no, you are, because I've already looked at your x-ray, and I know I can help you. I've helped patients like you. Once we extracted the teeth and we got rid of the bad teeth, we gave her the mini implants, and then we gave her teeth. I gave her the mirror, and she looked and she said, now I believe you. I didn't believe you before, but now I believe you, and that you helped me, and she was extremely happy. Yeah.
So, and as far as pain,
yeah.
Now obviously everybody deals with pain differently, but you say sometimes they could just you numb the area. Maybe they take a pill the night before, you prescribe, a pill in the morning, like to calm their nerves, and it's easy.
Yeah. For patients who have dental phobia, and most patients do, when they express about their phobia, their fear, we give them a sedative the night before and one like an hour before they take it, and then they come in and we do it. But I'll be honest with you, Randy, MiniDental implants are so non-invasive and so conservative that once I place it, it takes like 5-10 minutes. They say, that's it. I say, that's it. They don't even need the sedative.
Really?
We get them anesthetized, we get them numb, but they don't even need it. It's not like conventional implants that you have to surgically place them. and it can be very painful. And sometimes for conventional implants, we put patients to sleep. But for MiniDental implants, non-invasive procedure.
Now there was a picture you showed me in the green room.
Yes.
And you were showing me this implant in the gum. And you were saying that
Bloodless procedure.
Like there's no blood in some cases.
There was not even a drop of blood. There was not even a drop.
Are they kind of like just popped or screwed in through the?
Through the gums, yeah, into the alveolar bone, yes.
And it doesn't really hurt.
It really doesn't hurt, yeah. Again, because we are going through the gums, we have to anesthetize you. I call them the night before. I call them that night, the night of the procedure, and they tell me that I don't have much pain. I took, I haven't even taken the pain medication. I took my antibiotics, but I didn't need to take the pain medication. That's how
you give your cell phone to patients.
I do, yeah. Because they don't know what to expect. They don't know what they're feeling, if it's right or if it's wrong, if it's normal or if it's
So they can
abnormal.
call you at 10 o'clock at night and say,
they can call anytime.
I got a lot of swelling.
I give my personal, yeah. And I always tell them anytime, 2 a.m., 3 a.m. And to be honest with you, I've had patients who call me at 2 a.m.
Okay.
Yeah.
Now your wife's a dentist too, right?
My wife is a dentist, my sister is a dentist, my sister-in-law is a dentist, and my brother-in-law is a dentist.
So because you've been around dentistry for a long time, is this like the hottest, newest thing in dentistry?
It really is. Even my colleagues who don't have experience with it and don't do them because they don't know what it is, they don't believe it. After
what do they say? What do you mean they don't believe it?
They say, well, it really works. I mean, I didn't think because of, what other dentists tell them who have never done them, and they say, oh, I didn't think it was going, but I did it for a patient, I went for the training, I did it for a patient, and the patient was so happy and it was so nice and easy, one visit, and I placed it and no surgical involvement, very non-invasive, One of my colleagues, he said to me that they really don't work. I said, well, how many have you done?
What, the mini implants?
MiniDental implants. He said, yeah. Okay. He said, they don't work. I said, how many have you done? He said, I've never done one. I said, then how do you know? Well, the literature says that. I said, well, you can't go by that literature because we have other literature and
so
other
there are published
studies. Well, of course,
is it FDA approved?
FDA approved,
okay.
yeah. Last November, we had a big meeting in Dallas, and Dr. Gordon Christensen, who's in the vanguard of dentistry, he was there just to talk about MiniDental implants, and everyone knows him. Everybody knows, he's an expert in dentistry.
So mini implants are now accepted?
Yes.
Okay.
Definitely, yeah.
Do you think that's the future of dentistry? Because a lot of people, like I told you, I've had dentists that say, they're not big enough, they're not big enough, they're not big enough. And you say, that
let
statistically
me tell you, let me tell you, patients always ask me that. Why is it that so many dentists, are doing conventional implants and small percentage doing MiniDental implants? And I tell them because some of these dentists who are doing only conventional implants, they're in their mid-40s, mid-50s, they're in their comfort zone. They don't feel like going back and getting retrained for something modern. They've been doing this fine, they don't. I did it when I was in my late 30s. If I had to do it today, I might not do it today because I said, I'm in my comfort zone, I'm not going to do it today. That's one of the reasons. Another reason is that dental implant companies, they try to push the conventional implants. Why? Because when you do a conventional implant, you have to use 6 different drills. When you do a mini implant, you use 1 drill. So if you're a dental implant company, which one are you going to try to sell? Which one are you going to try to market? The ones that you end up selling more parts and more drills for
so
it.
There's more money in it.
More money in it, And we see that. We see the same thing in our society with pharmaceutical companies. Today they say to you that this drug is FDA approved. They did the 10-year trial period for it, and it's the best drug. A year later, they say, oh, no, don't use it. It's been damaging the valves of the heart. Then what happened to all the studies that they did, So it's the same thing with conventional implants and MiniDental implants. Conventional implants, the implant companies are trying to push them more because they can sell more.
The main thing is these mini implants work, and they're about half the cost.
Half the cost,
so it's
definitely.
a lot less expensive.
Yeah. It's one piece. it's one-piece implant, and much less than conventional implants. Yeah.
Now with these mini implants, you say they could eat right away, but once they're healed up, like could they eat like vegetables that are raw, or do they have to be careful?
No. Once they're healed and once the implants are integrated, they can. I always tell them, use them like your regular teeth, like when you had your teeth. You used to eat steaks, corn. You can do that with the MiniDental implants.
I mean, you could buy the carrot with your front teeth with
Oh, sure. Definitely. Why not? Yeah. Apples, carrots, everything. I had this one guy who came in and he had dentures. He was tired of dentures. He wanted to be able to eat corn. He wanted to be able to eat steak. And we gave him with MiniDental implants, we gave him teeth, upper teeth that were fixed and lower teeth that were fixed.
So these don't come in and out. These are like, they're stuck
they're
in
fixed.
there.
Yeah,
Okay.
exactly. And I told him, I said, listen, for the first 24 hours, you want to take it easy, soft diet, As I told you, I called him that night, just to check up on them. I called him and he said, I know you told me just to take it easy, but I've already had steak and it was wonderful.
Are you kidding me?
No, seriously. And he was so happy, and and I was happy for him. I was upset that he didn't follow my instruction, but I was happy for him. Another patient that I had, she was taking a lot of medications. She was getting dry mouth, dentures. You have to understand, in order to be able to wear a denture, you have to have saliva and you have to have good suction.
Okay.
Well, when you are taking medications, you don't have much saliva, so the dentures they become loose. So you have to use the glue denture adhesive. So this lady, we did it for her.
So she comes in, she's wearing a denture.
She comes in wearing dentures. We discussed placing MiniDental implants and placing fixed teeth. We did it for her. Another case that I had told her not to eat right away, give it 24 hours, just soft diet for 24 hours. Again, that night when I called, she said, I just had some corn. I know what you told me, but I had to try them.
Really?
I had to try to make sure that they really work. And so many patients like that, I hear all the time from my patients that now I can eat this, now I can eat that. I can. For some reasons, a lot of patients, they love eating steaks. I have a lot of patients like that. And they always tell me that I had my first steak, it was wonderful. And MiniDental implants help them.
Now, do they look real? Because I feel like I can spot a denture walking down the street.
If they don't look real, we're not going to place them in their mouth. We make sure. Sometimes I bring a lab tech, the lab tech that we work with. He comes in, he asks the patient what color you want, what shape you want, and sometimes they bring in patients bring in their pictures from when they had teeth, perfect teeth when they had them. And they said, well, this is how my teeth were. Can you make them like that, I had this lady who came in with dentures, malfitting dentures that were loose, and she said to me, you need to give me some teeth. You've done it for other patients, you've done it for some of my friends, and you got to do it for me.
Okay.
And I said, what is it that you want me to do for you? She said, fixed. I don't want dentures, I want fixed.
That means fixed teeth that don't come in and out.
Fixed teeth, yeah. So we gave her the MiniDental implants, we gave her fixed teeth. The husband saw her, and this husband said, well, I have dentures too, and I want you to do it for me too. And the husband was the next patient that we did for,
Is that right? So he was testing it first with the wife?
With the wife, yeah.
Most of these people, they don't need like IV sedation or oral sedation, just like
a
pill to relax them.
When they come in, sometimes they don't even need the pill. I'm being very honest with you. Sometimes they don't even need a pill. They think that they need to be put to sleep. They think that, they need a pill. But once we do it, that's it. They always tell me, you're done already? Yeah, I'm done already. Yeah.
And pain is not something they complain about.
Pain is not a big factor. It is for them. That's why
they're worried about it.
They worry about it. But once we do it, they realize that it wasn't. And in that case that I just explained to you, the husband and wife, the wife and husband, the husband was told by the wife that I didn't feel anything.
Now we're short on time. Take me through the process. So somebody watching this, they're either headed to dentures, meaning their teeth are bad and falling out, and they know they don't want dentures, or they're currently wearing dentures. What are their options when it comes to these small diameter mini implants?
So the first visit when they come in for a consult, we take a panoramic X-ray, and sometimes we have to do a CT scan, if it's an extreme case, not a lot of bone. On the lower, they have choices. They have choice of placing mini implants and retrofitting their existing denture to the mini implants, but then they tell you that I don't want dentures.
So like a snap in, snap out.
A snap, yeah.
Okay.
And they say they don't like it, you know. And most of them, they tell me, I don't want to take anything out of my mouth and any teeth out of my mouth, you know. I want it fixed, you know, like your own teeth, they tell me.
Okay.
So we place the MiniDental implants on the bottom or on the top, and then we place the fixed teeth that don't need to come out. And they're cemented on the implants.
And then
on the mini implants.
And you say they could eat like
They
that
can
night,
eat
but soft food.
Soft food, yeah.
Okay, but before you know it, like a couple of months, I mean, they could eat steaks.
Exactly.
What about chewy things like pizza? You can.
Oh, sure, yeah.
So it doesn't matter.
No, it doesn't matter. Nuts, apples, everything, yeah.
What about ice? I guess people
I
eat
wouldn't
things when you
recommend,
tell them not to do.
Yeah. I mean, I would just recommend them to take it easy. I mean, you know, not ice. I mean, even with natural teeth, you don't want to chew on ice, you know. But
and they stay white. I mean, how do you clean them? How do you keep? What's the maintenance like?
Well, remember the teeth that we were talking about. They're zirconia or sometimes PFM, porcelain fused to metal. You know, so they're not like natural teeth that they can change color. If they discolor, just a simple cleaning can, you know, get rid of the staining.
As far as follow-ups or checkups, how often do they come in?
It's like they got their teeth back. So every 4 to 6 months, they come in for a cleaning, you know, like when they had their teeth, you know, like you, like me, you know, that we go in for our cleaning every 6 months, you know.
Well, you're a dentist. You probably think the smile's like the most important thing. How important is it?
But it has nothing to do with me being a dentist, you know. I mean, a smile is important, you know, for job interviews, for people going on a date, you know. When you deal with people who are smiling, they say, oh, he was very pleasant, he was very nice.
Okay.
People who are not smiling, they say, oh, he looked miserable, you know, grumpy, you know.
Okay.
And so it doesn't matter if I'm a dentist or not, smiles are very important, you know, and a beautiful smile can really change people's lives, you know. I've seen people who didn't even take a shower before we gave them teeth, you know. I mean, they didn't look clean, they looked dirty, they didn't take care of their hair. After we did their teeth for them and gave them mini implants and mini dental implants and gave them beautiful teeth, now they come in there, even the way they're dressed is different.
Is that right? So when they feel better about themselves, more confidence.
Definitely, yeah.
The charisma. You know, we were talking in the green room that in Hollywood, when they make movies, if you want to make somebody look poor, you give them bad teeth.
Yeah.
People with bad teeth are judged. You see that all the time.
All the time, yes. I see that all the time, and I hear that all the time. They say, can you please help me because I'm going to be going for a job interview soon, you know, or I'm going to be getting... I have patients who come in, I have to tell you this story.
Okay.
This is a true story.
Okay.
They come in with a missing teeth in front, you know. They say, well, I'm getting married in 2 weeks. Can you give me some teeth? And with MiniDental implants, we can really do it in 2 weeks. We can give them teeth and get them ready for their wedding. You know, I mean, everybody cares about smiles and everybody wants to have a beautiful smile.
So when I have, and you said you could do it like right away.
We can do it right away.
Because I have doctors that say, but Randy, the way you really have to do it is you put the implant in, let it sit in there for 8 or 9 months, and then they come back and put the tooth on top. But you do it right away.
That's true for conventional, for the old-fashioned implants, yes.
Okay.
You have to wait 4 to 6 months and like you said, 9 months. But with MiniDental implants, right away we can give them place the mini implants and place temporary crowns that look as good as real crowns, you know. And they're half the cost and half the downtime and faster healing process.
You know, I had a dentist on my show, and he says, and he knew you were coming in today.
Yeah.
And he's worried about mini implants, right? And he said, well, ask him, would he do it on his own family member? So I asked you in there. Yeah. You said, yeah, I did it on my mother.
My mother was the first patient.
And you do both. You could have done the regular.
I could have done, I could have done.
Why the minis?
They work.
You like them better.
They work,
really
non-invasive.
Like
you know, my mother takes medication. She has some systemic diseases. I wouldn't want to put her through surgical procedure. You know, the most conservative way is placing mini dental implants.
So you tell all your dental friends that you went to school with, you say you got to do mini implants.
I tell them all the time.
You do.
I tell them all the time.
And
the ones who do them, honest to God, they call me. They say, you know, I did my first case and I'm very happy, and the patient is very happy. You know, you should have told me that sooner.
Is this the happiest group of patients of all dentistry? I mean, you take somebody with no teeth and give them teeth?
Yeah. I have patients all the time. They come in, they say, listen, I'm going to show you my teeth, but you've never seen teeth as bad as my teeth, you know? And that's not true. That's not true, because most patients with bad teeth, they don't smile. They tend not to smile, you know? And I tell them all the time.
So you don't see it.
You don't see it. Yeah, you don't see it. And I tell them all the time, no, I've seen worse cases. Yours is not as bad, you know, we can help you.
So who comes in more, the women or the men?
Both.
Okay. Now, do men tend to put it off more? That means until they're in pain, then they call you?
Or until their wives tell them that, you know, I'm sick and tired of your smile, you got to do something. Or
really?
Or grandkids. Grandkids say, Grandpa, your teeth are disgusting. I've been told that by patients that, oh, you know what, my grandkid told me that I have disgusting teeth. You know, and that's why I'm here.
So people, like, they're getting married, they're dating again, they're single or whatever. Because I guess wearing a denture, it's probably, especially in the dating world, people are dating in their 70s and 80s. It's got to be pretty embarrassing to be dating knowing you have a denture. Are there young people with dentures? Like 40-year-olds, 50-year-olds?
For 30s. You know, I've done it for, you know, patients who are in their 30s wearing dentures. And they had the teeth pulled when they were in their 20s, you know, and they come in, they say, listen, I'm still young and I don't want to have this thing. I don't want to take this out and put it in, take this out and put it. What can you do for me? And that's when I tell them we can place MiniDental implants and we can give you fixed teeth that you don't need to take out and put them back in.
Okay, good. And they look real.
They look real, yeah.
And your life's going to be better because you have teeth.
For sure. And you can smile more, yeah.
Okay, good. We're out of time. Okay. So for the denture wearer or the person that they have really, really bad teeth, but for whatever reason they're afraid, what do you say to them?
I tell them not to be afraid and to give us a chance to prove to them that we can help them and we can get rid of their dentures.
Okay. Now, we should mention Medicare, Medicaid, even with the best, doesn't cover
they
dental.
don't cover, yeah.
And also, even the best dental insurance doesn't really cover this at all.
Yeah, but don't forget, we have financing, and we do that for most of our cases.
So
we do
people
financing.
are making payments on
payment
these.
plans, yeah. They're
really? So with
affordable
good
payment
credit,
plans.
you can
Good
do it.
credit, go up on good credit, they can have it, yeah.
So like every
And,
week, they're doing this?
Every day that, as I told you, 99% of my practice is MiniDental implants, and financing is almost every single patient.
So no more dentures?
No more dentures, yeah.
Okay, great. I want to thank you for coming on the show.
My pleasure.
Great
Thank you for having me.
Is it a free consultation?
It's free consultation.
So they get to go there?
They come in, you know, and we talk and we look at their teeth, and if they're a candidate, then, you know, most people are a candidate, you know. And for those patients who've already had a consult somewhere else and they've been told like it was very expensive, they should come in and they should let us help them, and they should, you know,
look at the minis.
Look at the minis, yeah.
I want to thank you for coming on the show.
Pleasure to be here. Thanks for having me.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.